It's the most common type of malignant brain tumour among adults. Glioblastoma grows fast and spreads quickly, invading the nearby brain tissue. There is no cure, only treatment such as surgery, radiotherapy and chemotherapy that can ease symptoms. A few years ago, I met Richard Preston, living with glioblastoma. Despite being told he could have as little as 2 years to live, he's still beating the odds and enjoying life 8 years later.
And what did they tell you at the time?
Bad news, you've got terminal brain cancer, it's malignant, and it could grow back at any time. So within 5 days of the optician saying there's something dodgy at the back of your left eye, I was in the operation room, having a 6-hour operation on my head.
Wow. But you didn't have any, there was no pain,
No,
there was no symptoms, nothing?
No, the worst I had was a little headache. And they said, you need glasses. I went, fair enough, I've never had glasses.
Yeah.
Had glasses. And I said, right, I'll have glasses. 2 weeks later, I said, still got a bit of pain in my left eye. And they looked at it and went, oh yes, there is something there. The optician sent me to QA Hospital. QA Hospital said, we'll do a scan. After they'd done the scan the next day, they said, right, you're not leaving, because I actually walked past a monitor with my scan on it, and there's this huge black lump up behind my left eye. And that was a tumour, apparently.
Currently, for adult brain cancer, the median survival for the most aggressive ones, which are called high-grade gliomas or glioblastomas, is around a couple of years, and that has not changed for the past 30 years. So it's a very dismal prognosis, and there's a desperate need to develop novel therapeutics. And in the pediatric arena, brain cancer has now become the #1 cancer-related deaths in children.
But Dr. Maria Castro is feeling optimistic about her new research. A professor of neurosurgery and developmental biology at the University of Michigan, she's one of the leaders who are working with teams of neurosurgeons, neuropsychologists and engineers who've developed a new way to treat tumours which could delay or prevent recurrences.
They're hard to treat because, one, they're in the brain, so the surgeries have to be very conservative. The brain controls your life, everything. Eating, breathing, walking, it's the center of your body, right? So it's an organ that you can't really excise or remove large pieces of it without having very severe impact. So the way these tumors are treated is surgeries. And in case of children, there is one particular location, which is in the brainstem, where that is totally inoperable, because if you can't live without it, right? It controls breathing, eating, swallowing, equilibrium. So it's really the center. It's like the rheostat of the whole brain and body functions. And then there's another hurdle, which is the immune system in the brain is slightly different from the immune system in other organs, like in the skin, if you have a melanoma, or in the lung, if you have lung cancer, right? So the environment of the tumor is very immune suppressive. So it's very difficult to elicit an anti-tumor immune response. So it's a very, very hard organ to treat when there's a cancer in it.
There's also yet another hurdle called the blood-brain barrier. Throughout the body, there are small gaps between the cells that line the interior of blood vessels. These gaps allow ions and small molecules to pass from the blood to the surrounding tissues. But in the brain, these cells are closer together, even overlapping, which allows only nutrients, water, and some gases to pass into the brain tissue, keeping out pathogens, toxins, or drugs. There are drugs that have the ability to boost the immune response to brain tumours, which can't get past the blood-brain barrier.
We linked up with a very outstanding group of chemical engineers and biomedical engineers, and they have a platform which is we call it Nanomedicine. And this platform is kind of a very microscopic protein conglomerate, right? And in that conglomerate, you can encapsulate chemotherapeutic agents.
Dr. Castro, together with Dr. Jorg Lahan, developed a therapy utilising these synthetic nanoparticles made out of proteins naturally found in the body. They can cross the blood-brain barrier after they are delivered intravenously. So the drug is smuggled into the brain past the blood-brain barrier to elicit anti-tumour activity and stimulate an immune response that kills tumour cells. This encapsulated drug was actually developed a few years ago for other applications, but the team decided to see if it would work on the brain. It works in 3 modalities. It blocks tumour cell division, slowing the progression of the cancer. It normalises the defective blood flow in the tumour, which makes radiotherapy more effective. And it prevents immunosuppressive cells from entering the brain.
And also the blood-brain barrier has pumps that can pump out these chemotherapeutic drugs. So essentially, you need to put them in a shell that the barrier is not going to pump out. So once they get in, they stay in.
This was a complex puzzle to solve. The brain is clever and has numerous ways of protecting itself. But these glioblastomas are also smart. They make their own blood supply to help them grow. So scientists had to come up with a plan to make sure the nanoparticle found its target.
On the surface, they have what you would call the key. So these particles are engineered to find their log. So when you deliver them, they not only cross the blood-brain barrier because of their properties, but they could also find the tumor cells because the particles had the key engineered in them, and the tumor cells already have the log.
They tested the therapy on mice with what Dr. Castro describes as extraordinary results.
Then we delivered these particles systemically, and we treated the models in the same way as the human patients are treated with radiation therapy. And then we saw that when we delivered the particles, the radiation therapy alone failed. And when we combined the particles with radiation therapy, approximately 60% of the animals were cured of the tumor. And if those animals were given another tumor without any further treatment, they survived the second tumor, which means that these animals could remember the immune system of the animals, develop what you call immunological memories. So it's exactly the way the COVID vaccines work, right? You deliver a therapy, in this case a vaccine, the human body develops antibodies, T cells that have memory. So then when you get infected, it protects you. With brain cancer, it's the same. That's what we aim. So the concept is very similar. And that's what we aim to achieve in the human patients. Because I didn't tell you this part, what kills the patients is the tumor recurrence. The tumors always, so the surgeons can many times very effectively remove the main tumor mass, right? But even in spite of that, 2 years later, the tumors come back. So we really, really need that memory. We need the immune system to remember the tumor and to attack it when it's coming back.
Did you see any side effects in mice?
So in this particular publication, we looked at liver function, no impact on liver function. We looked at kidney function, no impact on kidney function. We looked at brain inflammation, there was no brain inflammation. We looked at spinal cord inflammation, no inflammation in the spinal cord. And then we did all the blood work and there was no abnormalities. So from what we've done so far, they look very safe. The safety profile is still not fully characterized, so we'll need to do further studies maybe in another model.
The next step is human trials, and it will take around 2 years to write the protocols to get the approval from the US Food and Drug Administration. But the need for a novel therapy is great, which should speed up the process.
A lot of groups, patient groups, family groups that deal with these patients, and it's a very, very stressful and debilitating disease. So people are really desperate. So the FDA really is very keen on pushing these experimental therapeutics in patients. So we hope to be in the clinic in around a couple of years from now and start treating patients.
So your outlook on life is just very positive.
I try and make it as positive as possible. I've had the cancer, I've had it taken out, I've had the drugs. I'm just cruising along now, waiting for it to happen again. Because they say it's inevitable, it's going to happen again.
So if you had the opportunity to take part in a clinical trial, to try something new,
yes,
would you take it?
Yes. I've already decided that anything I can do to help other people is worth me doing.